Bariatric surgery can be life-changing and life-saving, but for some, a gateway to an unhealthy relationship with food. Let's welcome Chaundra Evans, registered dietitian and author of the book BariEDucated. Glad to have you with us.
Thank you so much for having me.
So let's start with you as a registered dietitian. What does that mean exactly? What do you do?
So I work with people nutritionally on behaviors that can help really improve their quality of life. It is independent of what goals they bring to the table and what they want to work on. But big picture is they want to feel good. They want to have energy. They want to have a high quality of life. And a lot of what we put in our mouth is influencing that.
Yeah, it certainly is. And when you talk about the different clients that you see, do they run the spectrum from maybe borderline or anorexic, bulimic, and also overeating, food addicted?
Yeah, a lot of times what we see is dieting behavior starts and that becomes more disordered eating, and then it gets worse and more frequent, more intense symptoms, and then it becomes a diagnosable eating disorder.
Yeah,
so it's a spectrum.
What leads to that? What leads someone to have an eating disorder, whether it's on one end of the spectrum or the other?
Yeah, one of the things that's probably a misconception is that it's not so much about body, and it's more about wanting a way to have coping mechanisms to deal with something that can be really difficult in their life. And so when somebody is really restrictive in nature, that might be a way to numb emotions to help them through something really hard. And when somebody is overindulging in food, it might be a way to comfort them or self-soothe. Food is really accessible. Food can sometimes be affordable depending on groceries today in today's society, but food is everywhere, and so it's easy to get your hands on, and it's legal, and so it can be easily abused, but it is a form of self-soothing and comfort, and it often helps people get through really hard situations in their life.
I've heard a lot of stories of people who have endured childhood trauma that has led to overeating, like you say, because it is a comfort. And then once, they'll gain 100 pounds a year and then end up finding themselves to be 600 plus pounds. And that's when it becomes really real. You're almost on death's door, and you make a decision whether you want to change your life or not. Obviously, there's a huge psychological component to it and counseling that needs to take place, but also a shift in your relationship to food and discipline. So in order for someone to then be qualified to get bariatric surgery, there's some changes that have to take place, but then once they have the surgery, then what happens?
So if somebody is going into bariatric surgery as a candidate and it is recognized that they have an active eating disorder, it is both best to postpone bariatric surgery until that eating disorder behavior goes into remission. So it's really important for health professionals to know how to screen for eating disorders preoperatively. And even people that go into remission preoperatively, postoperatively, they often reemerge about 2 to 3 years after surgery. And that's often because the newness of surgery kind of wears off. Maybe a little bit of motivation declines because they're not getting so much attention for, oh my gosh, you lost so much weight, you feel so great, you look so great. The newness wears off, and then life happens. So stressful events occur and they start to build up, and we return to old coping mechanisms, which is then I'm going to turn to food again, or I'm going to restrict to try to get through this hard situation.
And, and typically speaking, bariatric surgery, that shrinks the stomach. It cuts, because when you've put on that much weight, your stomach has expanded, and you're always wanting to fill it in order to feel full.
Yeah, it makes the stomach capacity a lot smaller, so it can be harder to recognize eating disorder behavior, specifically binge eating, in a post-op bariatric patient, because the volume of food that constitutes a binge is significantly smaller in a post-op bariatric patient than preoperatively, so it's often missed.
Much smaller.
And vice versa, if there's readmission of anorexic behavior, the bariatric surgery is already restrictive in nature, so it can be hard to recognize restriction if you're not aware of what a normal bariatric lifestyle is. And so it's so important to be trained and have experience in what those behaviors look like, because it can easily be missed. And a lot of what we see in the bariatric population is atypical anorexia, where the restrictive behaviors are severe and the labs indicate a lot of malnutrition that can be really high risk, but it's not recognized because we do have a weight bias and a lot of prejudgments around weight, and we can tend to identify somebody that is a healthy weight or slightly overweight as they're doing fine, and that is not true.
What's more common for a bariatric patient to start to overeat, or for them to then start dabbling in anorexia and bulimia.
We're more likely to see binge eating disorder 2 to 3 years out from surgery.
Because they're just kind of going back to what they're already familiar with.
Yes.
I see. So what are a couple of ways in which you can keep someone on track post those first 3 years?
I would say staying connected with your support group and staying connected with other people who are going through something similar. So having a community of support. The support groups are incredibly valuable, and then staying connected with a treatment team as soon as you notice that you might need help. And so it's easy to think that these behaviors are going to pass quickly, but reconnecting with your therapist, reconnecting with your bariatric dietitian to have strategies, to have accountability is really valuable.
Yeah, absolutely. And all that information and more is in this book.
It is.
And where can people find this book?
At BariEDucated.com, so it's BariEDucated. It's only on our website.
Yeah, not Barry, but Barry. BariEDucated on this program.
Yes.
I want to thank you so much, Chaundra, for sharing with us.
Thank you.
Really interesting stuff.
Thank you.
We'll be back after this.